Inside Edmonton's Grey Nuns Hospital, ICU nurse Andrea Irwin can hardly believe what she's seeing each shift.
It's really shocking, actually, to see so many people so sick. And we're looking after people who don't have COVID, and we're looking after a lot of people who have COVID.
Alberta's ICUs are now seeing a record number of patients, 177 on May 12th, up from the province's second wave peak of 151 back in December. And because the number of new daily infections has been high for weeks, the pressure on hospitals is only set to rise.
The ICU admission number has been around 0.7% of the total, so 7 out of every 1,000. But then what's not factored into that really yet is the impact of variants, which has a higher risk for ICU admission.
But this week, the focus of Alberta's government has been somewhere else entirely. Members of Premier Jason Kenney's caucus spent much of Thursday in an emergency meeting after former caucus chair Todd Loewen publicly called on the Premier to resign. In the end, caucus voted to boot both Loewen and MLA Drew Barnes, another backbencher who has been a vocal opponent of government policies.
I regret that it had to come to this, but I respect the decision our caucus has made, and we're going to move on, focused on the priorities of the public.
The dissension among Kenney's ranks has been simmering for weeks. Last month, 16 caucus members signed a letter decrying the government's COVID restrictions. So removing 2 of the 16 is not likely to make the Premier's problems go away.
It's just postponing the eruption of more dissension, I think, down the road.
Until then, the Premier has more pressing matters at hand as the health system braces for what is likely to be a very difficult month ahead. Heather Yourex-West, Global News, Calgary.